All right, so hi everyone. I am Mandy Reed. I'm the postdoctoral fellow at FIU CAPS, and I'm here with Dr. Dornheim. She is the neuropsychologist. She primarily works on the BBC campus when we are working on site. And so today we're here to talk about attention deficit hyperactivity disorder, also more commonly known as ADHD. And we're going to be looking specifically at this diagnosis in the age of college students. So today is really meant at looking at criteria for diagnoses, what that might look like and present as. And please, if you have any questions or anything throughout, you can send that also through the chat feature. Or if you feel comfortable to do so, you could unmute yourself and ask a question at any point. You don't have to wait until I'm finished. Okay, so let's get started. So before we start on the content, I just want to briefly go over some things that you can know where to find us at CAPS. Like I said, when we are at CAPS, we're in the BBC campus, we're in WUC 320, and at MMC, we're in SHC 270. Right now, we're working only remotely, and you can still get us at the office number that you see here on the screen. So these are some services that we offer at CAPS. Right now, they look a little bit differently. So typically we would offer individual, couples, and group counseling in the context of therapy. Right now, we're not offering couples just because of the nature of being remote, and it's more difficult to navigate in that sense. We would also typically offer consultation, evaluation, and referrals for psychological testing. So I think more specific to this presentation, ADHD would fall under that. However, we're not able to administer those tests virtually. And so unfortunately, we're not offering the testing services, but the hope is that a presentation like this can help even more so with skills and just understanding what you might be experiencing. We have online modules, which you can find on our website, which has a range of different things. So on our website, we have self-help modules, which ranges from areas on anxiety, depression, relational concerns. There are so many different areas that you can use, and it really walks you through the different topic areas. We also have podcasts, and there is a really helpful program that we use called Cognito, which again is a self-help resource, and it's more so used for someone who is wanting to have a difficult conversation with someone else. And it really helps you kind of see the layout of those skills and allows you to practice that beforehand. So something to just note, our sister program is called the Victim Empowerment Program, and this is also a confidential service. So they're very similar to CAPS in the way of how they're seeing students, but their specialty is really focusing in on students who have experience or are involved with instances of sexual assault, relationship abuse, stalking, hazing, hate crimes, other violent crimes. And so this is their area of specialty. The difference in terms of the services that they offer is that they can accompany you. So if you have things like court hearings, if you're trying to initiate a restraining order, if you're meeting with attorneys, things of that nature, they're able to accompany you. So they're able to be with you. They're also advocates. So they're able to advocate, they're able to contact professors, registration problems, the conduct difficulties within the university. And so they are a good resource to keep in mind if you're experiencing any of these difficulties. Okay, so I'm gonna just run quickly over these slides. This is a lot of what I already spoke about, but they just look in a cooler visual version. Here we also have, this is the link that you can go to for directly accessing the Cognito program. All right, so let's just get into what it is that these workshops aim at. So this is an 8-session series workshop, but I think the cool thing about this workshop is that you don't have to attend all 8. They are individual sessions and they don't build on each other. They incorporate some similar strategies and skills within them, but they focus in on different skill sets. So today, we're not so much looking at skills, but more so looking at the understanding of the disorder and the symptoms that may come up in relation to that. And then we want to help direct you to some resources that you might be able to utilize. Okay, so let's first start just by talking about ADHD. What is ADHD? And so for a long time, this was a disorder that was considered to be only seen in children. And nowadays what we're seeing is that if a child presents with ADHD, the percentage or likelihood of that prevalence in their adulthood life is up to 70%. So it could be, as low as 50, but we're seeing majority of those cases carry on into adulthood. And that can, what we know is that that negatively impacts our academic functioning. It impacts even our social relationships and the ways that we think about ourselves. And so when a student moves to college, we see that oftentimes these stresses that come up are factors that also exacerbate or make or contribute to these symptoms feeling that much more difficult. And so that's something to keep in mind, because I think oftentimes people have the misconception that, oh, it's ADHD, you just grow out of it. That's just something you experience as a kid and that goes away. And that's not always the truth. That can be true, but most of the times we see that that's not the case. And so the objective of today is to, like I said, inform about ADHD in a general sense and to help undergraduate as well as graduate students to help cope with their symptoms. So what is it specifically? So this is something that we consider a neurobiological condition, which is characterized by symptoms of inattention, hyperactivity, and impulsivity. So people with ADHD in general find it difficult to maintain attention, to relax, and to think before acting. Something to keep in mind, though, is that while these elements are criteria within the diagnosis, you do not have to present with all three, right? So some people might have the inattention type, some people might have hyperactivity and the more impulsivity type of ADHD, and some people might have both. So it's not that someone who presents with ADHD needs to have all these elements. So if we think about where these difficulties are derived, it's thinking about, from a neurological sense, there's a developmental delay of behavioral inhibition. And so a person who has these difficulties, this is why they haven't developed, it's almost like a muscle. They haven't developed that muscle of inhibiting an impulse. So they might feel something in the moment and not have those tools within them to put distance between when that impulse happens and when they're acting on it. And so if you think about those instances where you don't allow yourself to think in between, you can kind of do things that have consequences that aren't, they might have more negative repercussions. And so it's almost, if you think about a child, I know right now they're having those those video where they video the kid and they put the candy in front of them and walk away and say, don't touch the candy. It's kind of that sense of the instant gratification, that we want something in the moment. And developmentally, as we get older, we learn to inhibit those impulses. But someone with ADHD might have more difficulty with that because of that neurobiological developmental delay in terms of how quickly they're acting on something. So that's something to keep in mind as well. Someone with ADHD, they can experience significant difficulties academically, professionally, emotionally, and even socially in college. And so when we think of from a holistic sense, I think sometimes when we think of ADHD, we're thinking of school, right? Like, I can't focus on my work and I can't do these things. But oftentimes those things bleed into other parts, and we'll break that down more as we go on into looking at how does this impact every aspect of your life. And it's not to say that it will, but it also might make things feel more difficult or overwhelming to a student. Okay, so how do we recognize if we have ADHD or symptoms of it? So a person with ADHD, in order to meet the criteria, so it's a very specific criteria. So oftentimes we hear people say, oh, I can't focus, I have ADHD. And I think that's just become like a colloquial term of, this is just really hard for me. But in terms of diagnosis, it is a specific criteria. And so you have to meet 6 or more of symptoms of inattention and or hyperactivity and impulsivity. And these symptoms have to be present before the age of 12. So oftentimes when people are coming in reporting symptoms of ADHD, we're asking them history of that symptom. So has this been happening since elementary, middle school? If it's no, then we would want to get more information about when these symptoms started and what's been happening, because a prime criteria for ADHD is that childhood difficulty with those, whether it's attention hyperactivity and those different things. So that's something that we also keep in mind, like thinking about your own experience. Is this something that's always been difficult for me? And it's likely that as you've gone on, it might feel as though it's getting harder. But at the same time, sometimes what we see is that someone might not have really they might have not been great with attention, but they found ways to like make up for it. But then you get to college and things change. The structure of a high school schedule, or being, with your mom in your house telling you when to do your homework, like a lot of those structures aren't there. You have to kind of help create those for yourself. And so what we see is that someone might not experience those things earlier on, but in college, they're now experiencing that for the first time. And so I think it's really nuanced, but it's really thinking about all these different elements of it. What we know too is that when someone has these difficulties from age 12, up to 70% of the cases have these symptoms persistent in adulthood. So now I'm going to break down the symptoms and we'll talk about what that would look like in the context of your life. So this first symptom here, frequently not paying attention to details, is careless, makes mistakes in academic tasks. So this would look like making errors due to a lack of attention. So for example, you're doing an assignment. It's not for not knowing how to do it, but you kind of just go through without paying attention, and you look back and you're like, wait, why did I not see that? But it's kind of that lack of attunement to attention in the moment of doing something. This person might hand in academic work incomplete. So you do parts of it, but not all of it. Needs a long time to complete detail-oriented tasks. For someone with ADHD, that's a really tedious task, because if you already have difficulty attuning to attention, if there is a task that involves multiple complex layers of it, that then heightens the pressure of needing to, it takes that much more energy for them to be able to complete that kind of a task, and subsequently takes a lot longer. And then has difficulty following through after starting tasks. Like, have you ever said, oh, I have this great idea, let me just start this thing. And halfway through, you're like, forget this. This is not fun anymore. I'm moving on to the next thing. And so it's that difficulty with kind of writing out those boring parts or the less stimulating parts, and then switching on to the next thing. And it's kind of a pattern that happens again and again. So then we look here at this symptom, often seems not to listen when addressed directly. So this would look like when you're talking to someone, they're seemingly thinking about something else. Like you can kind of sense when someone is not fully listening to you. So it seems like they're kind of daydreaming or in their head thinking about something else. Difficulties to concentrate on explaining behavior. So why did I do this? Why did I just do that? Someone is not necessarily in tune with, those pathways between, like we were just saying, the thought process and then the acting. And so difficulties concentrating or kind of pinpointing in that sense. Difficulties remembering content during lecture. So again, you kind of go into that place in your head of, have you ever felt like you're here, you're in the lecture, you're making an effort. I apologize if you can hear the sirens. But yeah, so you're in class, you're making an effort, you're like, I want to pay attention today. You're paying attention, 10 minutes into the class, you get a text message, you look at the text message, you start thinking about it, then that thought leads to something else, 30 minutes later, you're back present in the class and you have no idea what happened. that's something that's often difficult for someone with ADHD, that if they're veered off of the task at hand, they kind of go down on a spiral of all these different thoughts, and then they end up missing out on what's presently happening. And so what we know in school, if you're in a lecture and you've missed half the lecture, it's really difficult to pick up on where things are, and then sets you up for needing to do more work outside of class. In conversations, this person might change the topic frequently. So you're talking about something and they have a thought, and again, that difficulty with delayed gratification or impulsivity, they switch to the next thing and the conversation shifts, which again can be off-putting for someone else who is engaged with talking about something. All right, so this kind of piggybacks off of what I was just talking about, difficulties maintaining attention while on task. And so again, difficulties focusing on lectures, homework, exams, difficulty finishing homework or a task list. So like if you have a to-do list, it's really difficult to, like, you check one thing off and you're like, you know what, I'm good, I'm gonna watch TV for the rest of the day. So not being able to kind of stick to something and maintaining your attention while on that task. Easily distracted by other stimuli. I think this one is really important. So for some people, you know, they can have things playing around them, music, TV, whatever, and they're able to somehow maintain focus. Someone with ADHD, they might be easily distracted by all these things going on. So someone is having a conversation beside you and you're tuned into that conversation, or you see someone walk by and then you start thinking about, you know, what you need to do after class, where they're walking. Like all these different things come up for you, and it's really hard to then refocus back onto what you were initially doing. Easily bored. We hear that one a lot. Like, I just can't do this. It's so boring. And it kind of, again, piggybacks off the idea of we start something and it gets boring. And it's like, I need to switch to the next thing. And so when that happens, you've started many things, but you haven't had the accomplishment of finishing it. And then that impacts the self-esteem component. Like, I've started this thing, why can't I finish it? I can never finish things. And then it kind of impacts the way that you're approaching something altogether. So to me, it's like a chain reaction. And so it's thinking of all the different elements. Maybe you're in class or in conversation and someone asks a question which somebody already answered. Again, to that sense of not being present and in the moment of what's happening and what's going on. Okay, so another symptom we have here is difficulties following through with instructions until the end of a task and not completing academic assignments. So this might be a person who, you know, reads half of the instruction for an essay, writes the entire essay, submits it, and then realizes that they've answered the entirely wrong question because they didn't fully read what the thing was asking. Starts tasks but doesn't complete them. Complaints that academic work is excessive. So everything feels like it's too much. Like, I have too much work. This class is giving me too many assignments, too much material to study for this test. Like, it's really that difficulty with managing different things at the same time, and also like cognitively managing and organizing things in a way that feels like cohesive but also coherent. Like, you could go in a specific order. For them, it just feels like everything is just too much. Let's see. Oh, sorry guys, I'm missing some questions. So most cases of ADHD started in childhood. Is it possible for some to develop ADHD in teen or early adulthood? That's a really good question. Yes, so most cases do have a history of difficulty from childhood. Again, that's not to say that's always the case. For example, I've seen people who are just entering med school and are just experiencing those difficulties. They might have been hard before, but now that everything has amped up that much more, the difficulties have become more pronounced and cause more impairment in their functioning. And so it's not always that, like, I feel like sometimes people can learn to compensate in ways that it helps them. Like, you can know what classes to take or what to do. And you've kind of figured it out, like almost like working the system, like you've figured out how to help yourself be successful. But for someone, that might not mean that they don't have ADHD, but they've found ways to cope with it. However, as things get more difficult, those coping strategies might not be as effective anymore. And then you start seeing the difficulties become more evident. And so it's a great question because it's hard to say. It's not black and white in that way, but most cases of ADHD do start in childhood. And it's possible that you can present with ADHD later on in life without necessarily having those difficulties in childhood. Dr. Dornheim, would you have anything else to add to that question?
No, that was a perfect answer.
Okay.
And you will see that very often, especially when you work with graduate students.
Right. So like they might be able to function throughout, but then as things increasingly become more difficult, so graduate school, medical school, law school, like all those different elements where things become significantly harder, you start seeing those them present with more of those difficulties.
Mm-hmm. Correct.
Okay, so my arrow, sorry, my chat box was in the way. Okay, so now let's look at difficulties with organizing tasks and activities. So difficulties organizing, classwork or assignments, looking at like having difficulty saying, where do I start? I often hear like, I just have so many things to do. I don't even know where to start. So I just don't bother because it's just too much. And so it's again, that sense of difficulty with executive functioning, meaning organizing, planning, having a hard time meeting responsibilities. So things become, start piling up on top of each other. And again, add to that sense of feeling overwhelmed. Difficulty setting priorities in daily activities. So I think that kind of piggybacks off the point before where it's like everything feels like it's pending. Whereas what we know is that certain things are due before others. Also, certain things are going to take more energy or attention. And it's thinking in your mind, what's going to be the most logical way to get things done? Is it completing the easiest things first and then getting to the other ones? Is it, focusing on something that you know is going to take a longer time, but planning ahead so that you have more time to focus on it? Someone with ADHD might not have that capability to really have that forethought in terms of how they're approaching something. And so, yeah, for them, it feels like everything is just too much. This is not possible to kind of parse things apart. Sorry, we have a typo, but loses needed materials. So you spend half an hour looking for your car keys because you don't remember where you put them on the table. Or you knew that you typed your homework, but I can't for the life of me remember where it is. You've now delayed submitting the assignment. Your assignment's late, even though you've done it because of those organizational skills. So those are things that can also contribute to those difficulties. Difficulty managing time. And even, so the key is we make these schedules and agendas. The key is that we have to look at them. So they might forget to look at them or see when due dates are. And again, that delays work being submitted. I'm pausing for 1 second. I'm just getting some, that's Dr. Dornheim. Okay. All right, so let's look at the first one, which is difficulties engaging in quiet activities or calming activities. So this is the kind of person who would be having a full-on conversation in the quiet zone of the library, or even in a task that maybe most people might want to do in silence, they need certain stimulation around them. So that's why you might see someone with ADHD, if you're working in class, they might have the fidget spinners, or they might have Velcro on their desk, or something, a ball in their hand to play with, because they need maybe that external stimulation. And so it's really difficult to do things in silence without any other stimulation in that way. And then the second symptom that we have here is avoids or neglects activity that requires prolonged and strenuous mental activity. So these are tasks that are boring, or maybe ones that are more difficult, not necessarily having the ability to ride that out. That we know that who really enjoys writing a paper, or I mean, you might, but who enjoys studying for something? So there are certain things that just might never be fun, and we do them anyways. But for someone with ADHD, they might have a more difficult time even bringing themselves to do it, much less like sticking through it when it becomes difficult or hard. And so that's something that we see also impacting, the way that we feel about ourselves. That it's like, oh, I keep trying and trying and trying, and it's not working, so I just can't bother anymore. And we have that a lot because, again, it goes to that self-esteem component. That why would I keep on trying to do something that I consistently keep failing at? And so it's that sense of, one, it's that it's a symptom and it creates that difficulty, but then it makes it even harder when it starts impacting the emotional experience of what you're doing. Then we have the procrastination. Oh, I don't need to do it now. Let's just avoid it. I have 3 weeks till it's due. I'll just do it the night before it's due. On the night before it's due, you realize it's a 25-page paper that's due, and you wish you had started before. So it's that sense of putting things off until the last minute, but then that impacts how well you're doing on something, because you're not able to give it your full 100%, especially if you know for yourself you're not a person to sit down and bust out 25 pages. I don't think anyone really is, but some people are more capable of doing that than others, right? So I think that's something that it would also look like that as well. Avoids filling out forms or writing reports. So again, these menial tasks that might not take that much energy, but they're just boring. And we all know that. Even talking about these things, I don't think you have to have ADHD for these things to be difficult. But with someone with ADHD, you can imagine that being that much more difficult, because who likes doing, just the mundane, boring things that you have to do? But it's a part of the responsibility of a job or being a student or whatever that is. Avoids long lectures, avoids to fulfill long checklists, avoids complex work and repetitive work. So these are all kind of similar to each other. Okay, so let's see. Sorry, I'm just checking the chat thing. Considering that there are degrees, how can you differentiate a low degree ADHD from a very distracted person? That's a good question. So again,
that is where your training and your clinical judgment comes in.
Right. So it's a great question, but I think, to what Dr. Dornheim said, there are specific criteria and presentations of someone's level of difficulty. You're thinking how much that difficulty is impacting their life in different regards. So someone who's just easily distractible, there's a clinical difference in terms of how that person is functioning in their life. So the difference is that someone with ADHD, they really, it's from a neurobiological sense, where we can do different testing and we can see how things present on an assessment, versus someone who might not meet the criteria. They might have some symptoms of ADHD. It goes back to the beginning of what we said. I think some people think because they have difficulty with attention, they have ADHD. But the truth is, it's kind of hard to have an ADHD diagnosis because there's so many specific criteria of what has to be met within a certain amount of time, within a certain amount of, how it's impacting your life. So there are many nuances to what warrants a diagnosis. For someone who is easily distractible, their performance on a psychoeducational testing battery might look significantly different to someone who has clinically significant ADHD. With that being said, someone with a diagnosis of ADHD can also look different to the next person who has a diagnosis of ADHD, because that can vary between person. It can vary between the level of impairment on each person's life. So I think it's a great question. And it's also a really hard question to answer because it's so nuanced with so many different factors that you're thinking about at the same time.
For testing, we are putting a lot of effort into differential diagnosis. We have to rule out anxiety disorders, depressive disorders, all other conditions that also can go psychiatric conditions or cognitive conditions that are also presenting with attention or concentration difficulties, psychosocial stress, testing anxiety. uh, ADHD evaluation at CAPS normally takes 4 to 6 hours of intensive evaluation, just to rule out a whole bunch of stuff to make sure. Also, people with ADHD have a high comorbidity with learning disabilities. We have to rule that out too. It is a very intense process and extensive process.
Thank you, Dr. Dornheim.
You're very welcome. Thank you.
So hopefully that kind of answers the question. Okay, so someone might frequently lose work-related necessities or forget work-related activities. Forget pencils and books. Again, like we were saying, losing the keys, losing your glasses, maybe forgetting about necessary tasks that you need to do until after the fact. And then because of the lack of a system in place of how do I keep track of what I need to do, when it needs to be done by, and how I'm going to do it. And then what happens? We spend so much time on the back end of trying to figure out where things are, rushing to see when things are due, that you waste so much time doing that. You lose a lot of time in your day. And so someone with these difficulties, they might always be in a rush. They might always be like on the go or pressed for time, stressed out because there's no process as to how they're getting things completed. Puts necessities in the wrong places. So this again comes back to the element of organization, but also memory and getting things in a strategic order. And so some of these I've talked a bit about by easily being extracted by external stimuli. So it's really hard for them. For example, I don't even know if it was a fire truck or an ambulance that drove by earlier. Someone who hears that sound might have a very difficult time being able to tune it out or being able to focus in. They get very distracted by that input of information, which is sound. After being distracted, difficulties with refocusing. I think this is a big one. Someone with ADHD has difficulty selecting relevant information. So if you've read an entire passage, someone might have a harder time picking out what are the important points that I need to touch on in this paper, in this question, because it's hard to parse apart what's going to be the more relevant or important information. And like I mentioned earlier, this person might be always late. So restless, that feeling of, in your body, even just that physical restless feeling, not wanting to wait in lines, can't relax, fidgets a lot. So you might also see someone with ADHD, they might need to get up in the middle of the class, maybe walk a little and then come back and sit down, or walk to the bathroom, wash their hands, do something, because the sitting down for so long makes them so restless. And then kind of going off of that, there's this feeling of always needing to be doing something or always needing to be doing something else. So I'm doing this right here and now, but it's saying, wait, I should really be studying for this exam tomorrow. I should really be doing research on something else. And so you're never really fully present. And again, that difficulty with the dispersion of attention. Somebody with a hyperactive type of ADHD, they might seem to have, excess energy that they need to burn off in different ways. And it's really difficult in a setting that's asking you to confine that more. All right, so someone with ADHD, they might talk too much. So they talk fast, they might interrupt other people, difficulty waiting their turn or navigating when to speak, especially in a group setting. which then doesn't really free up much space for other people to talk or other people to engage and kind of have the back and forth, or the ebb and flow of the conversation. So it's this person might have difficulties with those social cues of impulsively acting in a conversation, maybe changing the topic, and then having people respond more negatively or maybe even more standoffishly toward them. And again, the fidgeting, needing to move the hands and feet, the nervous feeling. Someone might play with their hair often or bite their nails. And so these are more physical manifestations of what you might see, versus like the other ones are, you know, those cognitive difficulties of organization and things like that. These, in a physical sense, you might also experience those things in your body. And these are some extensions of that. 1 second, just checking the chat. These are good questions. So we have here, well, this is in relation to the diagnosis of ADHD, but this says, so it has to do with impairment, how much it actually affects them. And then the next question says, what about the mood? Are people with ADHD more irritable or moody? And then another one here, would someone with ADHD also have issues explaining their ideas? Excuse me, sorry. Getting their ideas across. So to the first question, yes, we are looking at their functioning. And so if someone is reporting like, I'm having difficulties with attention, yet I'm looking at their grades and I'm seeing that they have A's and B's, well, maybe we could just talk more about strategies of what you could try first and see if that makes that feeling a bit more manageable, versus someone who is struggling with ADHD. We might be seeing D's and F's in their grades. So things have to align, and it's looking at someone's experience of a difficulty might be different from the functionality of that difficulty in comparison to their other skills, their other abilities. So it's a very hard question to say it's specifically just based on impairment. We're looking at it in relation to a lot of different factors in terms of that individual's functioning, but also in a level of looking at typically a normative level of functioning for their peers. We're looking at that as well. So it's not primarily based on someone's functioning, because someone might come to you and truly say, I am struggling, I can't function like this, but you test them and on the test it's not presenting in that way, which isn't saying that this person isn't experiencing that, but it's not at the clinically diagnostic level, and the interventions are different at that level. Dr. Dornheim, I see you unmuted. Did you have something to add?
Nope.
Okay. What about mood? So we'll touch on this in a little bit. I think for sure it can affect someone's mood. I think it's again, there's a big piece of it that oftentimes I think people talk about ADHD as an academic difficulty, something that you struggle with attention. And yes, it is. And it's also something that impacts your social worlds, your relationships, the way that you interact. And
yes, so, especially social, because people are so spontaneous. They do things and say things before they start thinking how appropriate things are. So they get themselves into a lot of trouble, which then is very frustrating. And then they're getting very angry and they're getting upset because they're totally frustrated.
Yeah, and I think even in an academic sense, is thinking like, imagine you're doing something and it's not for a lack of trying, but you're still not able to get to where you want to be. That adds a whole nother layer of frustration, but also, you know, that self-esteem component or self-doubt. That's like, why is this so difficult for me? I'm putting in so much work, yet I can't produce the grades that I'm wanting. Or even in social relationships, if that person has difficulties with social skills, it's likely they're having a harder time maybe making friends or maintaining friendships. And so there's a big emotional component to it as well that I think that sometimes gets overlooked by, academic performance or ability to focus on attention. So I think it's a good question. I think the emotional component is a big part of it as well. And it's kind of almost like this learned avoidance, that I'm just not going to do that because I know every time I've tried it, it's not worked. So let me just avoid it more. And it kind of perpetuates those symptoms of ADHD, of avoidance, procrastination, because they've had those emotional injuries of like, I've tried and it doesn't work. So why am I going to bother to do that again? So I think they both feed into each other. Would someone with ADHD also have issues explaining their ideas or getting their posts across in a discussion? Definitely. So again, goes back to the cognitive element of ADHD, the difficulty organizing our thoughts, being able to put them in a coherent or cohesive manner, where it's more like that person might have more difficulty with something popping up into their head in the moment and then bearing them off of what it is they were trying to say. And so you as the listener might be trying to follow, but it's not making full logical connections, when for the person, that's a thought that just came up in their head, and it, in their mind, it linked to it. It made sense and they're talking about it. But for you, that transition didn't fully make sense. I don't know if that description makes sense, but for sure, someone might have difficulties expressing themselves or eloquently saying something. I love these questions. Thank you for sending them in. Okay, so we just have a couple more, and some of these we've talked about. So I think this is one too good. So some people with ADHD, they might even like interject in a way that they're like ending your sentences for you, or somebody's asking a question and they're responding before the question has been asked. And so for someone on the other end of that might be frustrating, or that might be off-putting, where you don't know how to respond to that. And so this is, in these ways, like interpersonally, this person might have more difficulty in the context of social relationships or group settings, which we know in college we do a lot of group work, especially depending on your major and things like that. But doing group work or even like student-led organizations is really difficult for that person to engage in a way that other people are kind of connecting with that. So impatience, difficulty waiting, those are things that we're also going to see. And again, it's different. Like I don't think any of us truly enjoy standing in a line, but someone with this difficulty really might not have the ability to sustain that process of delaying the gratification, waiting in the line. You might see this person. Have you ever seen those people in the airport where you're like in the immigration line, and then one line goes down by like barely one person and they're skipping to the next line? It's kind of like that, where it's like so eager to get to the front of where they're trying to be that they're constantly moving around. It's really hard to stay in one spot. Interrupts or intrudes frequently. We talked about this, but this one is important. Difficulty respecting boundaries. I think that's even different from interjecting in conversations. So I think we all have a sense of boundaries. These are things that, whether they're physical or emotional boundaries, things that are limits as to what we're okay with accepting and doing. And so someone with these difficulties, they might have a hard time, one, understanding what your boundary is or maybe why, but also respecting that they have an impulse in the moment and they're going to do something, and your boundary isn't really a thought in their mind at that point. It's not to say that they don't care, but it's more of like an impulse or a in the moment kind of response. And for someone who doesn't necessarily maybe know or understand that this person experiences these difficulties, for you might be like, come on, like, what are you doing? I told you this is not okay. So that can impact, again, in interpersonal relationships. Maybe using things without others' permission. I don't know if you all have siblings. They all borrow you things. But I think this is different, where it's like, it's to an extent where it's something that might not be something you've talked about, or they're like just constantly doing that, borrowing things without permission, intrudes into other people's activities. All right, so now we are shifting. I know that was a lot of just like information in terms of like symptoms and presentations, but I really appreciate the questions, because I think it kind of brings more life to the things that we're talking about, in the sense of like, we're not just saying this is this and this is how it looks. So if you have more questions, please feel free to keep them coming in. Okay. So what difficulties would people with ADHD encounter until graduation? Like, what's that gonna look like? So I think we've alluded a little bit to this, or I have, in terms of like talking about the interpersonal difficulties that one might experience. And so again, going back to that sense of someone with ADHD, they have experiences and they also tend to be more emotionally unstable, meaning that, again, it's acting on an impulse and acting on a feeling in the moment, with not necessarily giving yourself space to think about it. That impulsivity can also make it harder to, even in an emotion sense, you have a feeling and you kind of just go with it, or you kind of just do it. And what we know is that sometimes we can't do that. Sometimes we have to sit on something. Sometimes we have to give ourselves time to process, to think. And so someone with these difficulties might find themselves in situations where, like, for example, if you feel really angry at something, or you feel really sad, and you make an impulse decision like, oh, I'm just gonna, I don't even know an example, but you do something in the moment and you look back and you're like, why in the world did I do that? And this person, you know, we might give ourselves time, more space to think about it and say, wait, that's actually not something I really want to do. Like, say you miss someone, you text them, but you didn't really want to text them, but then you did it. And then, you know, like all these different ways that things might manifest in interpersonal senses. This person might have a harder time putting those impulses aside. And so we see that the self-esteem component is like, I can't, you know, I'm trying in school and it's not working. Socially, I might be having a harder time. So it like impacts those different levels of how someone is engaging with parts of their life. Sometimes also I've heard people say like, am I crazy? Like, why am I going through this? And sometimes it's just a lack of knowing like that these are symptoms that are consistent with ADHD. Sometimes for someone, a diagnosis can be really enlightening because it helps them understand like, look, I'm not crazy. My mom didn't really understand it, or my family doesn't get it, but it's not because I'm not trying. And so for some people, it can be really validating that it's not just me. This is this difficulty that I have. How can I work on it? And so I think sometimes people have that repeated experience of people saying, you're just lazy. You're really not trying. You need to just focus. And that for someone who truly has these difficulties is infuriating and also frustrating, because then you start to internalize it and personalize it, that why can everyone else do this and I'm having such a hard time. So someone might really experience those different waves of emotions based on, you know, difficulty with those symptoms of ADHD. So I don't think they're ever in isolation. They are kind of always impacting each other in a different way. I think it also depends on the person and their personality type, their supports, all those different things. But these are things that we should be thinking about as well. And interpersonally, again, the difficulty with navigating like social cues or skills, knowing when to speak in a group setting or interject, or when we're talking too much, or, you know, so many different things. And so we might see that this person struggles attentionally, but they might also struggle socially in terms of receiving less support from their peers and things like that. All right, so what can we do? It's not, so this, again, like we said, is just to understand these different components of a diagnosis, or even if you're not diagnosed, just these difficulties that you're having. what can we do about that? So someone who diagnoses ADHD is typically a psychologist or a psychiatrist. And how we do that is through psychoeducational testing, which is a number of tests which are assessing for different types of your functioning. So we're looking at someone's IQ, we're looking at someone's academic functioning, we're looking at their memory, the way that they function best, so their personal strengths and weaknesses in terms of how they're taking in information and processing it. We're looking at the speed at which they're doing that. We're looking at coordination, so hand-eye coordination, things like that. So it's a very extensive process, which, like Dr. Dornheim says, takes several hours, which we do over multiple sessions. And it's kind of like mini case studies. Like you're looking at all these different elements and trying to it's like a puzzle, putting them together so things make sense. So that's why I was saying earlier on, some of the questions, they're great questions. And I think they're questions for a reason, that sometimes they're really difficult to have one specific answer to, because there's so many pieces that you're looking at the same time. So yeah, that's how the testing is done. We also are doing these psychoeducational workshops, which we hope are informative and just provide information about the causes, the symptoms, as well as skills and strategies that have been shown to be effective. Some people use medication treatment, so that's often prescribed by a psychiatrist. The difference with a psychologist, a psychiatrist is a more medical realm of psychology, and they're the ones that would be prescribing medication. And it has been shown to be effective in many cases. What we know, though, is that medication alone oftentimes is not substantial, because someone comes off the medication and then, reverts back to those same difficulties. So what we've seen is that what's most effective if someone is on medication is also hand in hand with therapy. So cognitive behavioral therapy, and that's used as a way to help someone identify, for them, what are specifics of what make it difficult in their functioning, and how can they implement different strategies as to how to help them. So I think those two things hand in hand are a great resource for someone who does have these difficulties. And that's not to say, and I'm not saying that everyone needs medication, because not everybody does. And then just in terms of on-campus resources, again, I know we're remote, so it's a bit different, but the Disability Resources Center, and once you have a diagnosis or you have these difficulties, you can go to them with your documentation and whatever it is that they need, and they can help with accommodations, so that based on your individual needs, so that you can be able to access the information in the best way for you if you are struggling in just a general academic setting. This person says, can any psychologist diagnose, or he or she needs a specific qualification? That's a good question. So I think overall, I guess it depends on the type of psychologist, but yeah, in any psychologist who is at the doctorate level has had to do these types of testing. But yes, someone who specializes in this area of work is definitely someone that you would be seeing for that. I don't think, not every psychologist does testing in this way, so you would have to do research on your end to see, is this psychologist that I'm seeing, do they do psychoeducational or neuropsychological testing? And so that's a good question. It is a more specified area. Would you agree, Dr. Dornheim?
Absolutely. You need to have a training in assessment, like Dr. Reed, for example, is doing currently with me at CAPS during her postdoc, and she also had some assessment training during her pre-doctoral internship. Yes, you should have assessment during your graduate program and during your internship, and your postdoc exposure, or you can always train, during the course of your career. You always can train, going to conferences and consult with assessment psychologists when you want to specialize in this area.
Right. And I think that's a good point. Like, I think also it depends on the setting. I know that in schools, they're not doing this kind of testing where you can be tested for ADHD. It's oftentimes, I mean, in schools, meaning like K to 12. In colleges, not many colleges offer testing on site, but that's the unique thing of FIU, that we do offer that, which is really cool.
Yes.
Yeah, it's not common that colleges offer it on site. And so, we have students come in. So right now, like I said, we're not testing, but when we are in the office for a typical psychoeducational testing battery, that's gonna, if we're just using that for accommodations for school and things like that, that typically costs like $300, which I know it sounds like a lot of money. However, if you're getting that kind of testing off site, you're paying thousands of dollars. So I think that's the really beneficial thing of having this service at FIU, is that it's on a scale, and also is something that if you're truly a difficulty, is really to your benefit to be able to get that information and to really be able to seek the resources and accommodations that would be most effective for you. Okay. So these are just our references, not really much more to add to that, but this is the end of our first session. Please feel free to send in any more questions that you might have. I really like the back and forth of questions and discussion, even through the chat feature. You're welcome. So I hope this was helpful. I hope it was informative. And yeah, we will be doing more presentations. So this one was more, like I said, on the end of just knowledge of the disorder in general and what it would look like. But from here on, it's really more skill-based. And so it's looking at specific areas and skill sets that we'll be focusing on. All right, well, if no one has any questions, thank you so much. Sorry about the technical difficulties. It's a struggle, but we made it happen. Hopefully next time that will not be the case.
I hope so too. Thank you guys for coming and listening, and thank you for all of your great input. And I hope we will see you for session 2.
All right, bye.
Bye-bye.